About 2.6% of the adult worldwide had ongoing ADHD.
ADHD is akin to diabetes, where it requires lifetime management efforts. Recent studies in the US showed about 50% of the US sample of ADHD were diagnosed in adulthood. One of the things with ADHD is a dimensional condition.
Why is it difficult?
The problem is access to people trained in the diagnostic protocols, taking much longer than putting forth more effort and time.
Welcome to Khan Klinics, your dedicated space for exploring the vital connections that shape your well-being. Here we dive into everything from achieving peak physical fitness by mastering sustainable weight management to optimizing your diet for a vibrant life. We're passionate about uncovering the power interplay between your mental and physical health, offering you insightful strategies to nurture both. Join us as we unlock the secrets to embark on your self-confidence and your inspiration by interviewing the top-rated personalities, not from only the US, but around the world. At Khan Klinics, our commitment is to bring you evidence-based information that inspires you confidently control your health journey and live your life to the absolute fullness. I'm your host, Amir Khan. Let's get ready to unlock the true potential of being a human with the most amazing people around us. Ever wondered why some people seem to breeze through life while others feel like their mind hits pause in the middle of a conversation or struggles just to start the simplest of tasks? It turns out that knowledge is catching up fast. A new global study estimates that in 2020, about 2.6% of the adult worldwide had ongoing ADHD, meaning affecting nearly 140 million people worldwide. Up to 6.8% had notable symptoms even without a childhood diagnosis. At the same time, long-term use of ADHD medications appears linked with a modest increase in risk, like high blood pressure and artery problems, suggesting smarter monitoring is needed. So what's the solution? When we can't use medications for a long time, what's the right treatment? In the answer to this question, one study just released showed that adding internet-based CBT alongside medication helps adults with ADHD improves focus, mood, and daily life for an entire year afterwards. Welcome to another illuminating episode of Khan Clinics. I'm your host, Dr. Amir Khan, and today we are joined by a remarkable expert who has transformed how we understand and treat ADHD. He's one of the leading authorities in CBT for ADHD and involved in cutting-edge research, renowned worldwide as well. Dr. Russel Ramsay, PhD, before retiring in 2023, was the co-director of University of Pennsylvania Adult ADHD Treatment and Research Program, and an associate professor of clinical psychology and psychiatry at the Parham School of Medicine at University of Pennsylvania. He's an inductee in the Chad Hall of Fame and serves an editorial board in the Journal of Attention Disorder and Journal of Psychotherapy Integration. He's the author of many books, and he is co-author of Cognitive CBT for Adult ADHD, an integrative psychosocial and medical approach with Dr. Anthony Rostein, Rutledge, 2008, and non-medication treatment for adult ADHD. Dr. Ramsay, welcome to the show.
Dr. Khan, it's an honor to be here. Thank you.
So let's start off with the first question. Tell our audience, how is it to live with ADHD as an adult, the person himself? We love to hear it in layman's language. And for the people that are around the person who are looking after the ADHD person.
For the person with ADHD, ADHD can have many effects. There's virtually no area of life that goes unaffected. But generally, one of the main issues is being able to consistently follow through on intentions, on plans. And that can come across as time management, fulfilling work and relationship duties, and a host of other factors that have important effects on day to day life, which on the other side, living with or working with somebody with ADHD, you could see how that could become profoundly frustrating, particularly if you don't realize the difficulties are stemming from what is an underlying neurological based condition.
Okay. Thank you for explaining that. So would you say they're able to live a normal life and the people around them are able to function normally provided the safeguards are set in? Or are there phases when they can be having dips, deteriorate, be more depressed, be affected by the people around them, psychologically, socially, and mentally, be able to cope with stresses differently?
I think most definitely, very often with the supportive treatment, people can live quite a fulfilled life. We are thinking about ADHD as akin to diabetes, where it requires lifetime management efforts. So, in some ways, there can be periodic dips in functioning, and it's very sensitive to different conditions. In some circumstances, somebody with ADHD with adequate support and treatment and a circumstance where things are interesting can not just get by, but maybe even thrive, which makes it all the more frustrating when lack of clear structure and support, they can almost fall to the ground metaphorically, and it leaves people scratching their head, including the person with ADHD. I know I can do it, but I can't reliably trust that I'll do it whenever I need to do it.
Thank you for explaining that. Dr. Ramsay, give us an overview about their lives when they are young versus when they are grown up. And what adjustments do they have to make to cope with the pressures in a society?
There are two trajectories. One is the group of adults who were identified and diagnosed in childhood and maybe having some treatment supports, academic supports over the years, including in elementary school, high school, and maybe even later on in college, and even into graduate and medical schools. So it can be a long-standing issue where there are different transitions, because managing school in high school is different than college and is different than managing the adult roles in day-to-day life as a partner, as an employee. So it can go through many transitions, and there can be some ebbs and flows depending on, as I mentioned before, different situations. There's another ever growing group, at least in the United States, of individuals who might have had some very similar struggles, but not as severe, but chronically underperforming, maybe getting by with perfectly fine average degrees, but spending inordinate time keeping up with school, or maybe having to repeat grades or semesters in college, and maybe not recognizing that these chronic inconsistencies were in fact the result of ADHD. So there's many individuals who the technical phrases are late identified and first diagnosed with ADHD in adulthood. And recent studies in the US showed about 50% of the US sample of ADHD were diagnosed in adulthood for the first time.
And there are some effects on sleep, I understand. Would you explain to us what are the sleep difficulties that they have?
One is it can just be an old-fashioned coexistence of a sleep disorder, so like sleep apnea in addition to ADHD. Now, ADHD itself, it's attention deficit hyperactivity disorder, but we're really thinking about what best explains it is as a difficulty of self-regulation. How efficiently do you do what you set out to do? So that can also be coordinating all the behaviors that go into preparing for and getting to sleep. It can involve procrastination on sleep, compensating by not getting work or school done sufficiently during the day or evening and staying up late, and simply sometimes the symptoms make it hard to quiet one's mind, quiet one's body to be able to efficiently fall off to sleep, which you can imagine on top of ADHD, that's like pouring gasoline on fire in terms of trying to cope the next day, because then the poor sleep just magnifies the core effects of ADHD on one's life and functioning.
And Dr. Ramsay, in the society, what are the general stigmas that are associated when we are dealing with people with adult ADHD? A lot of people don't understand when they're coming across people who have ADHD, and they freeze. Basically, they don't know, and they start taking them as some isolated, different being. What would you suggest?
I think the situation is best captured by one of the early popular books on ADHD entitled, "You Mean I'm Not Lazy, Stupid, or Crazy?" Now, that's usually describing what the adult with ADHD thinks about themselves before they get the diagnosis. But this is also many of the attributions somebody living or working with somebody with ADHD, seeing their inconsistency, seeing them having a hard time getting started despite being reminded, despite knowing the deadline is coming. It can look like somebody doesn't care, including in a spousal relationship or a parenting relationship. It can come across that way to an employer, even though it's not an accurate conclusion, but that is the perception. So there's a misunderstanding. There's also the misunderstanding that people have that, well, I have problems getting started too, and I still get things done. Why can't you? Again, one of the things with ADHD, it's a dimensional condition, meaning some of the difficulties can feel familiar to people, like procrastination or having a hard time sustaining attention over time, but it's a much greater severity and magnitude for adults with ADHD. And these individual misattributions about people with ADHD are separate from views that ADHD is not a real diagnosis. It was made up by the pharmaceutical industry and other just patently wrong conclusions about ADHD as a condition.
Sure. There's a general notion out there that diagnosing ADHD is very difficult. When the kids, there is an urge to put them on medications and try to normalize them. It's hard to get a key diagnosis, and in grown up, it's even more difficult. Would you explain to our audience in layman terms why is it difficult? And why is it there is an urge to put them on medications? And are the medications really that effective without proper diagnosis and treatment?
I'll take the second part first. The approved medications, predominantly the stimulants, but there are some non-stimulants, for ADHD across the lifespan, accurately prescribed and monitored, are among the safest and most effective we have in psychiatry, maybe even in medicine. Now, in terms of the diagnosis, we have very good, accurate diagnostic protocols. So I think part of the difficulty is many practicing clinicians have not been exposed to ADHD in their graduate, I'll just say psychology, psychiatry, and medical training. It's not a standard part of many of the training programs, even though there's increasing diagnosis of ADHD and adult ADHD. So part of the problem is access to people trained in the diagnostic protocols, but we do have very accurate diagnostic protocols. And part of the protocols are looking for other explanations for what might appear to be attention problems, because many of the ADHD symptoms are nonspecific, like a fever in general medical practice. There may be other sources of a fever. It could be an infection, it could be influenza, it could be malaria. So similarly with ADHD, but the protocols are good at differentiating those, as well as identifying when things like anxiety or mood condition or sleep, as you mentioned, might coexist with ADHD. So we have it, but it's finding people who know how to do the evaluation and who are familiar with ADHD across the lifespan.
Thank you for explaining that. Dr. Ramsay, before we go on the treatment side of things, I want to go and get your views on families who have kids who are teens and acting odd. help us differentiate when there should be red flags to say, hey, this kid could have ADHD. And then if they do, what would be the next step they would take? So firstly, what are the red flags, or what are some of the alerts we should look out for?
With teenagers, one of the, and for also for children, but since we're talking about teens, looking at academic performance, not necessarily grades, but being able to follow through and complete assignments. And with teenagers, it's increasingly expected to be able to do so independently or with some support. And taking much longer than putting forth more effort and time and still not getting the outcome out, and maybe even sacrificing sleep or extracurricular activities trying to keep up with school. This is what I mentioned before. One of the misunderstandings of ADHD is viewing it as laziness, but sometimes with teenagers or adults with ADHD, they're actually working longer hours for less outcome. So that would be seeing the teenager who's putting in a lot of time doing the reading but can't comprehend it. It could also be sometimes in athletics and sports. A swimmer loses concentration in the midst of the swim meet. The football player forgets to play by the time the American football player breaks the huddle and goes to the line of scrimmage. Now, these come across not just one time or one setting, but across different settings, and simply just forgetting things, even with friends and teammates, that these sorts of recurring across situation difficulties can raise a red flag. There could be other explanations, but these could lead to at least considering ADHD as a diagnosis and how treatment could help improve it.
And they have commonly other emotional symptoms as well: anxiety, mood behaviors, mood disorders, and sometimes depression. What a remarkable journey we've just experienced together. The path to health isn't always straight, but it's always worth the effort. I hope today's conversation inspired you to take the next step in your wellness journey, armed with new knowledge and a fresh perspective. If today's episode left you inspired, share it with someone who need to hear this. Give us a thumbs up and your opinion. Keep exploring, keep evolving, and we'll see you in the next episode of Khan Klinics.